What is up, everyone? And I appreciate you tuning in to the RT Clinic because today is a special little video, very short, but very important. So we have to be more ready for disasters when they come. So I had a really cool opportunity in the last week to be able to get my hands on a few expired pieces of equipment. And our hospital here is extremely prepared for anything, and that's a great thing about working for a great facility that like I do. One thing that happens is things expire, and we know that there's lots of different disposables in the respiratory units and the nursing units all over the hospital and clinics that expire because they have an expiration date. Well, after that you can't use them. Well, really cool opportunity that I have to get my hands on the expired Vortrans. So if you're familiar with Vortran, check the video out up there. I'm going to put it in this side, I think, of how to run a Vortran. Now, Vortran is a disaster ventilator. These are the ventilators that are used for mass casualty. It's glorified bag valve mass ventilating. I mean, you can just pressures and have pop-offs, but it's definitely for disaster. And many hospitals really needed these in the United States, especially outside the United States during the pandemic when we had so many patients on ventilators. So these have expired, and I really want to get these in the hands of respiratory programs. So respiratory students or nursing students with nursing program. So this is how we're going to do it. I've been trying to think about how to do this, and I don't want somebody taking one of these trying to sell it on eBay. This is not what it's about at all, and it's not about making any money. But I think it's really important that when and if this happens again, and I don't like to speak it into existence, but if it would happen again, that there are going to be trained professionals that know how to use the Vortran. So these are the expired ones. They recently expired. They still work just fine, but they can't be used medically because of the expiration. So I really want to get these into the hands of some programs. Now, I don't, if you're a student from a nursing program or respiratory therapy program, and you know that your clinical leaders, that your instructors do not have a Vortran, and if you're not familiar with what that is, I'm not sure why you're watching the video, but that's okay. It is the VAR ventilator. Looks about like this. Looks like a piece of plastic. It's got oxygen that comes in one side. It actually will ventilate the patient out this side. And like I said, it's flow-driven, pressure-regulated type of ventilation. So, but what I want to do is I want to get as many of these expired ones I can to nursing programs or respiratory therapy programs, so that the next time this happens, that there'll be some clinicians out there that if they're given one of these and said, hey, help us out, can you use this? They'll have seen one before. So this is the best way that I can think of to do it. I don't have a lot of them. I have a few, but I would like to mail them out to you for your program. Now, please don't have all 50 RT students send something in to me, because I want to send them to the individual programs. So my email will be in the description. If you will send me an email with your name and your program and an address where I can send this. I can send it to your house as long as you get it to your program. That's all good. I just want these to be available for people to use and to be ready for future disasters if they're coming. And because we are going to be the front line that are going to be starting these. You pull these things out and nobody's seen them for 2 or 3 years, it might be difficult to get one going. But I want the next generation of healthcare workers to be able to see this, have their hands on it, and then possibly it may help us someday if we're in a disaster and it's your family, my family, some of our loved ones, some of our community members that are in major stress and they need this. So the Vortrans, they're going to cost to ship. So I'll leave a link in the bottom if you want to give $4 to help ship it. I'm absolutely good with that. If you cannot give $4, I get it, and I will cover it. I don't have a lot of them, and when this is finished, I'll actually probably do an update on this video so people won't keep emailing in. But this is going out to all the RT Clinic, the tried and true, who have been watching me from the beginning. And I don't care where you're from. I mean, half of my viewers are from outside the United States. So if you send me the information on how to get it to you, and as long as it's not gonna cost about $50 to get it there, I will, I'll work on it. And like I said, I appreciate if you want to give any kind of money to help ship them. Obviously, it's an expired piece of equipment, but I really think that it will be great for the next generation to know how to use Fortrans. Now they have a new one out, and these are the new ones. Obviously, our hospitals purchased these nice ones. Go to Vent. These are really nice. They have a cool manometer on them. They've got some other really cool options, PEEP valves, awesome stuff, perfect, acute lung injury. I hate to say the word, but COVID type stuff would work really well with this. So they have a new one. These are the ones that we're using, but I wanted to give away to the next generation of frontline therapists and nurses one of these. So one per program. Please send an email to the bottom, and I'll get these out as soon as I can. I just really appreciate all of you guys liking, subscribing, buying merch if you want to. I haven't really sold much, but that's all good. And my badge buddies, if you're interested in those, they're also available in the link at the bottom. I have those on eBay. They're really cool. Shout out to a bunch of people who have purchased them. It has ventilation on one side, oxygenation on the other. These are 100% authentic from just kind of things that I've thought of that respiratory therapists and pulmonary nurses might need to know in the future. So send me an email on the bottom, and I'll get these out, and I'll post something, probably a top comment or something, when I am fully out of them. So this is to you. I appreciate all that you've done, and we need you educated with your hands on these type of devices for the future. Later.